the best vitamins for seniors. 4 dangerous vitamins you should never take and 4 must take daily if you are over 60. What if I told you that the vitamins you're swallowing every single morning, the ones you believe are protecting your heart, boosting your brain, and keeping you strong might actually be doing the opposite? What if I told you that some of these healthy supplements could be slowly damaging your nerves, shrinking parts of your brain, hardening your arteries, and even raising your risk of an early death? And the scariest part? Most seniors over 65 are taking at least one of these dangerous vitamins every day without knowing it. This isn't fear-mongering. This is clinical, peer-reviewed research data showing that older adults who take certain supplements without medical guidance have up to a 40% higher risk of early mortality. And in today's video, you're going to learn exactly which vitamins are secretly harming you, and which ones can extend your life, sharpen your memory, strengthen your heart, and even lower your risk of death by as much as 36%, according to a major European study. The truth is simple. After 65, your kidneys don't clear toxins the way they used to. Your liver slows down. Your nerves become more fragile. Your digestion changes. And the vitamins that were safe when you were 40 can become dangerous, even toxic, when you're older. Yet so many seniors wake up, open a supplement bottle, swallow a handful of pills, and unknowingly overload their body with nutrients their organs can no longer handle. That ends today. Because in this video, we're revealing the 4 vitamins seniors should never take after 65, and the 4 vitamins you must take daily if you want stronger immunity, sharper thinking, and a healthier, longer life. Stay with me until the very end. The final vitamin on our safe list has been scientifically linked to a 36% reduction in all-cause mortality. That's not marketing hype, that's real epidemiological data. Before we dive in, let me know in the comments where you're watching from. I love seeing how far our senior community reaches around the world. And if you find this information valuable, hit that subscribe button, tap the bell icon, and share this video with a friend or family member who needs it. You could genuinely save a life today. Alright, let's begin with the vitamins you must avoid, starting with one that sounds harmless but can quietly poison your liver as you age. Dangerous vitamin number 4, vitamin A. Vitamin A sounds innocent. It supports vision, skin, and immunity. But for adults over 65, the retinol form found in many multivitamins becomes dangerous. Why? Because vitamin A is fat-soluble, meaning it stays in your liver and fatty tissues rather than being flushed out. As you age and your liver slows, retinol begins to accumulate, leading to chronic toxicity. Symptoms like dry skin, dizziness, blurred vision, or joint pain are often mistaken for aging, but they may be signs of retinol overload. Worse, a 2022 European study linked excess vitamin A intake to a 25% higher risk of atrial fibrillation, the heart rhythm disorder strongly tied to stroke in seniors. The safe alternative? Food-based beta-carotene, found in carrots, sweet potatoes, spinach, and eggs, because your body only converts what it needs. Dangerous vitamin number 3, iron supplements. Iron is essential when you're young, but after 65, iron supplements often become harmful. Older adults stop losing iron regularly, so every pill adds to your internal iron storage tank. Excess iron builds up in the liver, heart, and pancreas, creating oxidative stress that damages tissues and accelerates aging. High iron levels mimic normal aging symptoms: fatigue, joint pain, memory issues, heart palpitations, so most seniors overlook it. Unless you have a diagnosed deficiency or recent blood loss, you likely get plenty from food. Excess iron raises your risk of Alzheimer's, heart disease, and liver damage. If you're taking a multivitamin with iron, stop and ask your doctor for serum ferritin and transferrin saturation tests. Dangerous vitamin number 2, calcium. Calcium supplements seem like bone insurance, but for seniors, they're more like artery cement. After 65, bones stop absorbing calcium effectively, so excess calcium from supplements starts depositing into arteries, joints, and soft tissues, raising the risk of heart attack, stroke, and calcification. Research shows calcium supplements, especially without vitamin K2 and D3, can increase cardiovascular events. Seniors taking acid blockers absorb calcium poorly anyway, meaning the supplement provides little bone benefit but substantial cardiovascular risk. The safest approach: Get calcium from food sources like yogurt, leafy greens, almonds, chia, or sardines, and avoid standalone tablets unless prescribed. Dangerous vitamin number 1, vitamin B6 in high doses. Vitamin B6 is marketed as a nerve and energy booster, but in adults over 65, high doses become neurotoxic. Unlike other water-soluble vitamins, B6 accumulates in nerve tissue. Regular doses above 50 milligrams can damage the sensory nerves, causing numbness, tingling, burning feet, balance problems, and muscle weakness symptoms often mistaken for neuropathy or old age. Many multivitamins contain more than your body needs, and when stacked with fortified foods, seniors easily hit toxic levels. The recommended daily amount for older adults is barely 1.5 to 1.7 milligrams. Only take B6 if diagnosed deficient otherwise. Choose multivitamins with low-dose B6 to prevent irreversible nerve damage. Essential vitamin number 4, magnesium. Magnesium powers more than 300 enzyme reactions and becomes increasingly critical as you age. Seniors lose magnesium due to decreased absorption, increased kidney loss, and medications like diuretics and acid blockers. Low magnesium leads to leg cramps, poor sleep, anxiety, irregular heartbeats, and weakened immunity. Deficiency also increases the risk of dementia, diabetes, and atrial fibrillation. But not all forms work. Magnesium oxide passes through the body poorly. Seniors benefit most from magnesium glycinate, citrate, or malate, which are gentler and better absorbed. A daily dose of 250 to 400 milligrams supports muscle, brain, and heart function. Essential vitamin number 3, vitamin D3. Vitamin D3 acts more like a hormone than a vitamin, controlling immunity, bone strength, mood, and over 1,000 cellular processes. After 65, natural production drops by over 50%, and most seniors become deficient. Low D3 levels are linked to fatigue, depression, muscle weakness, respiratory infections, and increased mortality. A major British medical journal study found seniors with adequate D3 had 30 to 50% lower risk of respiratory infections and death. Most multivitamins only include tiny amounts. Seniors generally need 1,000 to 2,000 IU daily, taken with food for better absorption. Choose D3, cholecalciferol, over D2 for best results. Essential vitamin number 2, vitamin B12. Vitamin B12 deficiency is extremely common after 65 because stomach acid decreases with age, preventing B12 absorption from food. Low B12 causes fatigue, memory issues, numbness, leg weakness, and balance problems, symptoms often mistaken for early dementia. If uncorrected, nerve damage can become permanent. Supplements bypass the stomach and provide reliable absorption. Seniors should take 500 to 1,000 micrograms daily in the form of methylcobalamin or cyanocobalamin, either as a pill or sublingual. B12 supports healthy nerves, red blood cells, mood, and mental clarity, and correcting a deficiency can make seniors feel 10 years younger. Essential number 1, omega-3. Omega-3 fatty acids are the most powerful longevity nutrient for older adults. EPA and DHA reduce inflammation, keep arteries flexible, protect the brain, and regulate heart rhythm. A massive 2021 European study found that seniors with the highest omega-3 blood levels had a 36% lower risk of death from all causes. Other studies show omega-3s reduce fatal heart attacks by up to 45%. Despite this, 68% of older Americans are deficient. Seniors should take a purified fish oil supplement providing at least 1,000 milligrams of combined EPA plus DHA daily, or 2,000 milligrams for heart issues. Vegan seniors can use algae-based DHA, which is equally effective. If you're over 65, the vitamins you take or don't take can shape your energy, your memory, your mobility, your heart health, and even your lifespan. The truth is, some supplements can quietly harm you, while others can help you stay sharp, strong, and independent for years longer. So check your labels, speak with your doctor, and make smart choices. Your future health depends on what you put into your body today. If you found this video helpful, please subscribe, hit the bell icon, and share this video with someone you care about. You never know, this information might save their life. Thank you for watching, and I'll see you in the next video. Stay healthy, stay informed, and stay empowered.